dripping through time, untold psychedelic stories. The rise, research, and fall of psychedelics.
Once considered a scourge of the nation, today psychedelics are undergoing a renaissance in the modern-day fields of therapy and psychiatry. According to Dr. Rosalind Watts, PhD, although many of us think of psychedelics as dangerous drugs, it's time for a rethink. They are non-toxic, non-addictive, have very few side effects, and could potentially offer relief for people suffering from a range of psychological difficulties. According to a 2016 academic study in the National Library of Medicine published by David Nichols, recent and exciting developments in the field have occurred in clinical research, where several double-blind, placebo-controlled Phase 2 studies of psilocybin-assisted psychotherapy in patients with cancer-related psychosocial distress have demonstrated unprecedented positive relief of anxiety and depression. Indeed, much research has shown that psychedelics offer a powerful insight to the inner workings of the mind and have shown potential in clinical research. So why, then, is there such stigma around these substances? And why are they banned if they are found to be remarkably non-addictive? In today's video, we'll dive deep into the intriguing story of how and why psychedelics were made illegal in the United States. In the mid-20th century, substances like LSD, psilocybin mushrooms, and mescaline were not just legal, but were also the subjects of scientific research. The 1960s saw a cultural revolution, the counterculture movement, where psychedelics became symbolic of an era. Figures such as Timothy Leary championed their use for personal and spiritual growth. However, the early 1970s marked a turning point with President Richard Nixon's declaration of a war on drugs. This represented the dawn of a more punitive approach to drug policy, including psychedelics. The year 1970 saw the passage of the Controlled Substances Act, wherein substances were classified into 5 schedules. Schedule 1, which includes LSD, psilocybin, and MDMA, is reserved for drugs deemed to have a high potential for abuse and no accepted medical use. The media played a crucial role in shaping public perception of psychedelics, often painting them as dangerous and unpredictable. A moral panic surrounding drugs further fueled the move to criminalize them. In the 1960s, the Harvard Psilocybin Project conducted research on the potential benefits of psychedelics. However, legal battles ensued, ultimately contributing to the prohibition of these substances. Fast forward to recent years, and there is a resurgence in interest in psychedelics for therapeutic purposes. Clinical trials are exploring their potential in treating a variety of psychological difficulties. So, where does the future of psychedelics in the USA stand? With ongoing research and shifting public opinion, there's hope for a more balanced and science-based approach to psychedelic policy. The journey of psychedelics in the United States, from being embraced by scientists and the counterculture to being stigmatized and prohibited, is a complex and multifaceted story. As the landscape continues to evolve, it's crucial to remain informed, open-minded, and willing to expand our horizons of belief and override the dogma we've been taught regarding these intriguing substances. So, to summarize, the stigma surrounding psychedelics largely stems from societal and governmental responses in the 1960s and 1970s, fueled by moral panic and the war on drugs. However, despite this, interest in their therapeutic potential has seen a resurgence in recent years, challenging the long-standing negative perceptions. The prohibition of these substances, despite their potential therapeutic benefits and non-addictive nature, highlights a disconnect between societal perceptions, policy, and scientific evidence. This historical journey through the world of psychedelics invites us to rethink our attitudes, challenge societal norms, and embrace a more evidence-based approach to drug policy and therapy.